Assalamu alaikum, guys. My name is Muhammad Ali Danji. I'm a fourth-year medical student. I just wanted to talk quickly about lung cancer and smoking and how you can stop smoking. Okay, so lung cancer is quite common. In fact, it causes 22% of cancer deaths in the UK. So I did feel like it's something that we should be aware of. So some of the risk factors associated with lung cancer are stuff like if you have a family history of lung cancer, so lung cancer runs in the family, or you've worked in an occupation where you're exposed to industrial dusts like asbestos. But actually the main cause of lung cancer is tobacco smoking. So 90% of lung cancer is caused by tobacco smoking. So some of the symptoms that you should be worried about with regards to lung cancer. So you're thinking about things like a persistent cough, a cough that's lasted for around 3 weeks, coughing up blood, unexplained weight loss, sudden shortness of breath, recurrent chest infections. These don't necessarily mean that you have lung cancer, but if you do get these things, then it'd be worth going to see your GP so you can, so he can investigate further. So you're probably asking, like, should I stop smoking? Yes, you should stop smoking, because smoking not only causes lung cancer, but there's a lot more things that smoking is associated with. So it increases your risk of heart disease and stroke, and then COPD is caused by smoking as well. Other cancers, such as bladder cancer especially, are caused by smoking. So it's definitely something that you should think about stopping if you are smoking. And if you look at this graph, some of you might be asking actually, if I've been smoking for 50 years, is it worth me stopping smoking now? What difference will it make? Well, actually, if you look at this graph, if you look at the bottom line, which is with white dots, that's the risk of someone who has never smoked. And if you look at the risk of someone who's stopped at age 50, it's a lot less than someone who's never stopped smoking, that line at the top. So actually, whatever age you stop at, it's basically worth stopping. It's never too late to stop smoking. So how can you stop smoking? Well, nicotine replacement therapy is what has been used for many years now. So basically, nicotine is the thing that gets you attached to smoking, gets you addicted to it. And nicotine replacement is where you administer nicotine to yourself to help with those cravings. And you can do that in multiple ways, such as like skin patches, chewing gum, mouth sprays, etc. And actually, it works pretty well if you use a patch and a spray. So that's something you can think about. And then there's a couple of other drugs that you'd have to get a prescription from a GP, but they work pretty well as well. So those are Champix and Zyban. And the last one, which I think is quite in fashion and vogue these days, is e-cigarettes. Like I see a lot of people here smoking e-cigarettes. So how e-cigarettes work, they essentially administer nicotine and flavor in a vaporized form. So they don't actually combust the nicotine. And in doing so, it gets rid of, it doesn't give you tar and carbon monoxide, etc. And something that's quite encouraging is that 2 out of 3 people who have used e-cigarettes in combination with the NHS Stop Smoking service quit smoking successfully. So there is a lot of benefit in attempting e-cigarettes. And I think what it is with e-cigarettes is when you smoke, there's the conditioning behind it's a lunch break, so I'm going to go outside, I'm going to smoke, and that's something you get used to over time. And with e-cigarettes, you kind of get the same type of stimulation. So definitely something to consider. And lastly, I'd just like to put up that the contact details for NHS Stop Smoking. You can just call them and contact your local station. Thank you.
Thank you for that enlightening talk. I would now like to call upon Sheikh Jafar to come forward to deliver tonight's majlis. Muhammad wa ali Muhammad salawat.